Hi everybody, and now we're in Lifestyle Management, Chapter 2, Psychosocial Health, Part 2. Alright, in this part we're going to look at mental illness. So we're going to consider what is it, and a very brief overview of mental illness. Please be aware that the topics on mental illness are meant to give you an idea of the diversity of the topic, okay? I teach a course in abnormal psychology, which is much more in-depth and a more deeper view of these and other psychological disorders. And as I say to my students in that course, I'm going to say it to you as well, please do not self-diagnose or diagnose others. It's tempting, but don't do it, please. You are not an expert and do not know enough about diagnosing criteria from or based on the DSM-5. Okay, so please bear in mind this is a very brief overview. There's not enough in this particular chapter to do any diagnosing by anybody. Okay, so let's get started. So understanding mental health. So mental healthy individuals value themselves, perceive reality as it is, and accept their limitations and possibilities, carry out their responsibilities, establish and maintain close relationships, pursue work that suits their talents and training, and feel a sense of fulfillment that makes the efforts of daily living worthwhile. So when we consider then what is mental illness, it's a different story. A report on mental illness in Canada defines mental illness as categorized by alterations in thinking, moods, or behavior associated with significant distress, dysfunctioning, and impaired functioning. Now, it's really important to sort of consider this. When I teach the abnormal psychology, we look at 5 basic conditions, that it's got to be distressful to the individual. So when we consider some things that we might say loosely, my OCD is kicking in because I happen to like things to be neatly lined up or something. The person who experiences OCD is under a great deal distress. It's not a momentary, alignment issue. It's a lifelong, 24/7, 365 a year, daily, distressful, dysfunctioning, and impaired functioning, as is all of the mental illness issues that we're going to touch base on. Some of them, of course, would be more obvious to you, but others not so much. And we're going to explore this. So mental illness includes mood disorders, and all that it's in an umbrella of mood disorders, schizophrenia, anxiety disorder, personality disorders, and eating disorders. And we're going to explore some of these, okay? Now again, I'm going to remind you, these are a brief overview. So does mental health affect physical health? Well, there's a site, and it's in Canada. It's about depression, and it's called Depression Hurts. Now, it doesn't mean that depression hurts other people or depression hurts yourself on an esoteric or sort of a non-specific manner, but that the physical hurt exists. Mental illness affects the mind and the body. Depression has increasingly been recognized as a serious risk for physical illness as well. Treating mental health problems leads not only to an improved health, but also to lower healthcare costs overall in any given society. So when we think in terms of mental health, what's the diversity in mental health issue around? What can we consider there? Mental illness affects people in all occupations, educational levels, and income levels. There's no preference to some people over others based on some other category. Now, we could say that, income level or cultures, however, there are some mental health issues that affect women at a higher rate than they affect men in all age groups. Young adults are also at some risks, and cultural assimilation plays a role as well. Now, cultural assimilation is what occurred in Canada when, with Indigenous people, we moved them from what they believed in their own norms and cultural variations into and assimilating them into what we thought was appropriate for them for Canadianizing them. And so loneliness, isolation, alien religious rituals, suppression of their own native language, ridicule, harsh punishments, and sexual abuse experienced at some of the residential schools across Canada have been very emotionally devastating to many children in First Nations, Inuit, and Métis descent. Just that whole process of removing elements about who you are. As you remember from part 1, we talked about self-esteem. You know, the things of that nature can have a powerful impact on your mental health. And then, of course, compounding that, the removal from families and the disconnect occurred, it's made things much more difficult for people now in the Indigenous populations, how they gather back together in families to re-engage how families work again. There are growing reports that people experiencing homelessness, which include absolute homelessness, being at risk for homelessness, or hidden homelessness. Now, hidden homelessness is really reflective of people who couch surf, the homelessness you don't see, but it's still there. Now, these degrees of absolute and being at risk of homelessness and hidden homeless are more likely to experience mental health issues. If you haven't got any stabilities, you can remember, if you will, with Maslow's hierarchy of needs, that many people in degrees of homelessness are still at the very basic physiological levels, maybe safety levels on the hierarchy of needs. Getting to the point of love and belonging isn't a part of their agenda. They're still trying to get food, shelter, the basic water. Once those are addressed, then maybe some degrees of mental health can alleviate some, but there's a huge degree of mental health issues in homelessness. Widespread misconceptions about mental illness cause further problems, and we get a lot of these misconceptions in the media, movies, even newspaper articles, magazine articles, and blogs, and yada yada yada. You go on forever. Many individuals are subject to stigma, the severe social disapproval, whether that's formal or informal, direct or indirect. We'll very briefly explore some of these groups of psychological disorders that we're going to explore. We can consider who we know or who may experience any of the following psychological disorders and how social stigma may affect them. Okay? All right, so let's begin by looking at anxiety disorder. Now, anxiety disorder does not just mean one mental illness. It's an umbrella of which others fall within. Anxiety disorders may involve an inordinate fears of certain objects or situations, and these would be normally called phobias, episodes of sudden, inexplicit terror, panic attacks, chronic distress, generalized anxiety disorder, or GAD, or persistent disturbing thoughts and behaviors, obsessive compulsive disorder. Now, generalized anxiety disorder, it's also known and abbreviated as GAD, is an excessive or unrealistic apprehension that causes physical symptoms that can last 6 months or longer. And some of these conditions that I will express in this chapter are just representative that many of us will have experiences of anxiety. But perhaps for an hour, a day, maybe even a week or two. But for someone who's diagnosed with generalized anxiety disorder, we're talking 6 months or longer. Many individuals do not seek treatment for their anxiety, yet most who do, even for severe and disabling problems, improve dramatically. The stigma that can be attached to even something as, what we might say is, well, it's just anxiety. We all have anxiety. But the stigma attached to it can limit people's ability to go in and get to the support. Now, as mentioned, phobias. Phobias are the most prevalent type of anxiety disorder, and they are the out of the ordinary, irrational, intense, unreasonable, and persistent fears of certain objects and situations. There's literally hundreds of different phobias, and it's not really specific about everybody gets this or that. It's really about what gets developed in terms of our faulty thinking. If you think of a person's fear of dogs, it's not because dogs are all bad. It's because they've had some bad experiences that have become an irrational fear that this experience with this dog this time represents all dogs all the time. And that's where it becomes irrational. No medication is effective by itself in relieving phobias. The best approach is behavior therapy, which consists of gradual, systematic exposure to the feared object, a process that's known as systematic desensitization. If you're afraid of spiders, you won't start touching spiders, but you might look at an image of a spider, or you might look at, and you gradually get to the point where you can be in the same room as a spider, and then maybe to the point where you can sit side by each with a spider on a table and not have these fears. It's systematic, it's gradual, and it's with the fear object. Now, another anxiety-based disorder is what's known as panic attacks or panic disorder or post-traumatic stress disorder. These are three different types of conditions. Individuals who have had panic attacks describe them as the most frightening experiences in their life. Short of breath, attacks can occur. Well, I'll go through. The panic attack disorder develops when attacks reoccur and apprehension about them becomes so intense that individuals cannot function normally. Now, when I'm talking about panic disorders or panic attacks, or these are intense. These aren't something that we might have and then sort of go, whew, that was tough. These go on for a while. There's a fear so extreme that you may really believe that if things don't happen soon to correct, you may even die. Now, you won't die, but the experience is very powerful. Now, there's two primary treatments for panic disorder. One, cognitive behavior therapy, which teaches specific strategies for coping with symptoms like rapid breathing, and medication is the possible support. Now, the cognitive behavior would be learning breathing techniques, learning relaxation techniques so that you can reduce the panic when it's occurring, and it takes practice. Now, in post-traumatic stress disorder, and also known as PTSD, individuals re-experience the terror and the helplessness that they've maybe experienced in the past and again in their dreams or in these intrusive thoughts. Now, a lot of times it's not just, and it gets associated with military, but they're not the only people who will experience PTSD. It'll be found in the firefighting industry and policing, but also in rape victims or in people who have experienced very traumatic experience that are not a part of a job that they've done. A variety of experiences can forever change the way in which people view themselves and the world around them. Combat, captivity, fire, floods, car accidents, witnesses of assault, sexual abuse. The sooner trauma survivors receive psychological help, the better they are likely to fare as a result of that. New therapies include nonverbal engagement such as images, symbols, metaphors, drawings, writings, conscious breathing and movement. There's a lot of effort being put forward into PTSD as a result of the number of conflicts militarily around the world that affect many of the people who have attended and many of soldiers. Now, obsessive compulsive disorder, OCD. Some individuals suffer only from an obsession. This is the reoccurring idea or thought or image that they realize, at least initially, is senseless. But the most common obsessions are repetitive thoughts of violence, contamination, and doubt. Now, it's important to recognize obsessive, which is the reoccurring thought that you can't not think about anymore, and compulsion. That is the, I don't know why I need to do this, but by doing it, I feel a little bit better, but if I don't do it, everything's going to fall apart. So most people with OCD also suffer from a compulsion. This is the repetitive behavior performed according to certain rules or in a stereotype fashion. Now, if you were to watch people experiencing OCD, you might see the humor in it, perhaps, and there's no humor in it for the person experiencing it. In my abnormal psych class, I post a video of Howie Mandel and how he talks about his OCD and the impact it's had on his life. Most people's response to seeing the video is they weren't aware, one, that he had OCD, and if they were aware, they weren't aware of how troubling and hard it's been to live the life of an OCD person. Individuals with OCD realize that their thoughts and behaviors are bizarre, and they cannot but they cannot resist them, and they cannot control them. OCD is believed to have biological roots. That is to say, there's some genetic or biology associated with OCD. It may be the result of gene abnormalities, head injury, or even an autoimmune reaction to after childhood infection with strep bacteria, for example. Treatments may consist of cognitive therapy, behavior techniques, and medication or combinations of. Now, another disorder in this category is attention disorders, attention deficit hyperactivity disorder, ADHD. It's a psychiatric diagnosis to describe individuals who are hyperactive, impulsive, and may or may not have inattention behaviors. Now, there are 3 types of ADHD. Predominantly inattentive. Type 2 is predominantly hyperactive impulsive types. And then type 3 is a combined type. Now, the causes are complex, and they include genetic and biological factors. Between 40 and 70% of children with ADHD do not outgrow their condition. Children with ADHD may find it hard to concentrate, read, or make decisions, complete complex projects, and meet deadlines. My own experience, I wasn't diagnosed until I was 42. Looking back at my childhood, explains a lot of the difficulties that I had in school and the challenges that teachers had with me. It wasn't that I was hyperactive, it is that I was overly attentive to too many things, and that's the misnomer about ADD. It's not about not being able to pay attention, it's being unable to discern the difference between what I should pay attention to and what's extraneous. But when you learn strategies, it enables you to access a more focused response to things. It doesn't mean that it disappears, it just means you cope with it differently. Now, depressive disorders. Depression is the world's most common mental ailment. It affects the brain, the mind, the body in very complex ways. Approximately 8% of Canadian adults will experience major depression at some point in their lives. And the onset of depression usually occurs around adolescence. Many mental health issues occur in late adolescence and early 20s because it's when we start to get more pressures to perform, whether it's to live independently and achieve, do your own schooling and get a job, that these things can stimulate some of the onsets of early mental health issues. Psychotherapy is remarkably effective for mild depression, and in some serious cases, antidepressant medications can lead to dramatic improvements. Exercise is also a good way to both prevent and treat psychological problems. Now, in the category that's broad in this area, and this is where we can look at major depression. The simplest definition for major depression is sadness that does not end. The incidence of major depression has soared over the past 2 decades, especially among young adults. Some of the characteristics in terms of symptoms of major depression can include feeling depressed, sad, empty, discouraged, tearful. Loss of interest or pleasure in once enjoyable activities. Eating more or eating less than usual, and either gaining or, of course, then losing weight. Having trouble sleeping or sleeping much more than usual. You see there's the dichotomous sort of perspective. It's either too much or too little, but it's problematic. It causes grief. Feeling slowed down or feeling restless and unable to sit still. A lack of energy. Feeling helpless, hopeless, worthless, and inadequate. Difficulty concentrating, forgetfulness, inability to think clearly or make decisions, persistent thoughts of death and suicide, withdrawal from others, lack of interest in sex, and there's also some physical symptoms like headaches, digestive problems, aches and pains. So we're seeing major depression is majorly influencing the life of a person very significantly. In most cases of major depression can be treated successfully, usually with psychotherapy, medication, or both. Psychotherapy alone works in more than half of mild to moderate episodes of major depression. 3 or 4 patients treated for depression take antidepressant medication. So it's important, to be aware that these aren't the normal light versions of sadness that we might experience. One case suggests that aerobic exercise, 30 minutes, 3 to 5 times a week, has proven effectiveness against mild to moderate depression. Good to know. For individuals who cannot take antidepressant medications because of medical problems, or for those who do not improve with psychotherapy or drugs, electroconvulsive therapy and the administration of controlled electrical current through the electrodes attached to the scalp remains the safest and most effective treatment. It seems kind of scary, but it's surprisingly effective with major depression when these other options don't work. Another, bipolar disorder. It used to be known as manic depression. The characteristic symptoms of manic depression include mood swings, changes in thinking, changes in behavior, and changes in physical condition. During manic periods, the individual makes grandiose plans to and takes dangerous risks. Now, that doesn't mean jumping off of, the sides of buildings with parachutes. This could be gambling. This could be financial risk, investing all your savings. However, they may often plunge from this the highest of highs, into a horrible low depression episode. Mood stabilizing medications are the keystone of treatment, although psychotherapy plays a critical role in helping individuals understand his or her illness to rebuild his or her life. Now, what's important about this is to bear in mind with manic depression or bipolar, a lot of times what fails for people with this disorder is that when they are manic, they think everything's great. And so they go off their medications until they're depressed. And the cycle continues only because there's not consistent application of the treatment. Now, also we can consider premenstrual issues. Premenstrual syndrome, or PMS, and premenstrual dysphoric disorder, PMDD, refer to a wide range of physical and emotional symptoms that affect a woman about 5 to 11 days before she begins her monthly menstrual cycle. Physical symptoms include bloating of the abdomen, breast tenderness, headaches, fatigue, less tolerance for noise and lights. Emotional symptoms can include feelings of sadness, anxiety, poor self-image, or tension. Behavioral changes can include irritability, hostility, outbursts of anger towards others. Now, the exact cause of PMS and PMDD is not really known. And a lot of the psychological disorders don't always have a known cause, and that makes treatments really challenging. Seasonal affective disorder, or SAD, compared to clinical depression, people with SAD experience some of the common symptoms of depression only during the fall and winter seasons when the sun is lower and we see less of it. Some research suggests that SAD might result from the shorter day lengths where exposure to sunlight is limited. Treatment for SAD includes light therapy. You wear these lights that shine down on your eyes, or phototherapy. That's, again, a use of light. Other treatments for SAD include antidepressant medications, counseling, and spending more time outdoors during the winter months. Now, a really significant psychological disorder which we misunderstand dramatically is schizophrenia. The symptoms of schizophrenia, one of the most debilitating mental disorders, includes hallucinations, seeing things that aren't there, delusions, believing things that aren't true, an inability to think in a logical manner, talking and rambling in incoherent ways, making odd or purposeless movements, and not moving at all in some cases. That's canatotic. Repeating others' words or mimicking their gestures, showing few, if any, feelings. It's called flat affect. responding with inappropriate emotions, lacking will or motivation to complete a task, and functioning at a much lower level than in the past. Now, schizophrenia might be the result of failure of brain development that occurs in early life. It has strong genetic basis. It's not the result of upbringing. Parents don't cause this. It was long believed that that was the case. So it's not a result of upbringing or social condition or traumatic experience. A comprehensive treatment program includes antipsychotic medication, education, family support, rehabilitation, cognitive therapy, and integrated addictions programs. Now, we can also touch on suicide in this component of mental illness. While not a psychiatric disorder, it does not get classified in the DSM-5. Suicidal behavior is highly correlated with mental illness, and it can be tragic consequences of emotion and psychological problems. There is concern about Aboriginal youth suicide, and it's been happening at a higher rate in many locations around Canada, where it's estimated to be 5 to 6 times higher than that of non-Aboriginal youth. So what leads to suicide? Well, there's no conclusive answer or explanation for suicide. A constellation of influences may combine in ways that lower an individual's threshold for vulnerability. Some specific factors believed to be linked to suicide, they can include, well, more than 95% of those who commit suicide may have a mental disorder. Could be diagnosed or undiagnosed. Many of those who commit suicide drink beforehand, and the use of alcohol may lower their inhibitions. Drug abuse can also alter thinking and lower inhibitions against suicide. Hopelessness and helplessness may be the most common contributing factor in suicide. Investigators have found abnormalities in brain chemistry of individuals who complete suicide, especially low levels of metabolite of the neurotransmitter serotonin. And if you're in nursing or have done some work, if you took my psychology class where we looked at brains and biology, serotonin is a very important neurotransmitter associated with mood. And also, another issue associated with suicide and why it occurs, access to guns can add to the risk of suicide, and major life crises can increase the risk of suicide. Long-standing, intense conflicts with family members or other significant people may also add to the danger for some people. All right, we looked at a few of the mental illness issues, psychological disorders. So where can I turn for help if I need help? As a student, your best source for identifying local services may be your college health unit, your student services. There's counselors there, and if what they can do to help is useful, that's great. If they can redirect you to somewhere in our local community, that is helpful too. So that's one of the first things as a student you can do. Your education, your future. A guide to college and university for students with psychiatric disabilities from the Canadian Mental Health Association focuses on particular aspects of college and university experiences and how students who are faced with mood disorders and mental illness can improve their level of self-care while studying at academic institutions. So there's at least a national and provincial directive to help students with mental health issues. Within the community, you may find help through community mental health centers, local hospitals, psychiatric or psychological associations, or even your family doctor, but reach out to somebody. Now, there's more than one type of therapist. So let's consider some of the types of therapists that there are. Psychiatrists, they're licensed medical doctors, MDs, that are trained in various forms of psychotherapy and psychopharmacology. And they can prescribe medication, and that's what makes psychiatrists separate from, say, psychologists. Psychologists, they have completed a university degree and require licensing, and they cannot prescribe medication, and there's one of the differences between psychiatrists and psychologists. Psychoanalysts, Well, they are either psychiatrists or psychologists and have taken special training in psychoanalysis. Now, that's Freud-based therapy, and it's not the only therapy out there. They assist clients in overcoming past trauma, and that's one of the major contributing components of Freud. Look to the childhood experience and how that might influence the adult experience. Now, there are certifications and licensings that are dependent by province for psychotherapists, for marriage counselors, So other therapists, including pastoral counselors, social workers, stress management counselors, alcohol and drug counselors, may or may not have licensing, but all need training and education. Now, some of the options for treatment, well, the term psychotherapy refers to any type of counseling based on the exchange of words, guided imagery, or healing work in the context of unique relationships that develop between the mental health professional and the person seeking help. So it's the talk therapy, essentially. Now, psychodynamic psychotherapy takes into account the role of early experiences and unconscious influences in actively shaping the behavior. Now, this is all the Freud-based, the psychodynamic. Psychodynamic treatments work toward a goal of providing greater insight into problems and bringing about behavioral change. Now, it's not the only therapy out there. Psychoneuroimmunology is a branch of medicine that acknowledges the interaction between the psychological factors and our central nervous system and our immune system. This is regulated by our neuroendocrine system. And so they take this is very much a psychomedical background experience. Now, away from the medical, you look at interpersonal therapy, IPT, and it focuses on the relationship in order to deal with unrecognized feelings and needs and improve the communication skills. Now, when we talk about interpersonal and focuses on relationships, it looks at your interpersonal relationships with your family, your friends, your acquaintances, and how you can improve your communication skills to bring about better mental health. Cognitive behavioral therapy, or CBT, it focuses on the inappropriate or the inaccurate thoughts and beliefs, distorted, if you will, irrational, and helps the individual break out of the distorted way of thinking and replace it with a more healthy way of thinking about those same issues. Behavior therapy strives to substitute healthier ways of behaving for the maladaptive patterns that we've used in the past. Psychiatric drug therapy uses psychiatric drugs that alter the brain's chemistry and relieve psychiatric symptoms. It's often used in conjunction with psychotherapy and is sometimes used as a primary treatment. It's important to note that with most treatments, there will be a partnership in many cases with medication. Medication is rarely used by itself. Now, an alternative mind-mood medicine, consumers are increasingly trying natural products such as herbs and enzymes that claim to have psychological effects, but because they're not classified as drugs, they have not undergone rigorous scientific testing required of psychiatric medications. Some medical professionals are concerned that little is known about their safety and efficacy. That is, they do what they say they can do consistently. Health Canada has put a regulatory framework into place that now oversees the regulation of all natural health products. It's important to remember that natural doesn't necessarily mean risk-free. For example, St. John's worts, maybe many of you have heard about St. John's worts, has been used to treat anxiety and depression in Europe for many years. Because of the possible side effects of the drug interaction, St. John's wort should not be taken in combination with other prescription antidepressants. And so it becomes something that we need to seriously look at in terms of our treatment, that one, find treatment that works best for you. So interview therapists, interview counselors, and be very careful about using non-licensed and non-clinically tested medications to deal with psychological disorders. I hope this has been helpful. I wish you good luck and carry on the good work, everybody. Bye now.